Elementary school student, chances are, certainly, hopefully, the conversation is going to be very different than for a middle schooler.
Do not be too graphic when you are talking to young children about this. And look, we're talking about the elementary school age. You know, I have kids in elementary school, so when I talk to my kids, I'm not going to talk to them like I would a teenager. Do not use very graphic terms, but keep reinforcing safety, safety, safety.
I'm imagining children are going to be afraid to go to school when they hear about this. So how do we reassure them that it's okay to go to school on Monday and they're going to be all right?
Yes. You tell your children that the school has taken every precaution necessary to make sure that they are safe. And make sure that this is, just because this happened in Connecticut does not mean it's going to happen here as well.
Dr. Cornbluth also, and I think you touched on this a little bit, we'll have the conversation, probably all of us as parents tonight, but then it's important in the days to come to watch your child, because I know my kids, they react differently. Still waters runs deep. You may think nothing is going on, and then later you'll hear something. So this is ongoing. This isn't going away, is it?
No, and especially with something as traumatic as this. And the kids that were in that school today, I mean, let's focus there because that's what happened today. They are going to have flashbacks for probably weeks or months on end. And even though they're not verbalizing what is happening, watch for nonverbal signs, such as spending time alone or crying or saying, I don't want to go to school because my stomach hurts. These are all signs that something is wrong and symptoms. And in the end, you know, it's always good if things continue to get some sort of counseling. And for the parents as well. I mean, everyone's in shock right now.
And that's what I was going to ask you, because we saw the president choking back tears. All of us are sitting at our desks thinking, oh my goodness, how could this happen? So as parents, what should our demeanor be as we talk about this with our children? I feel like I might start to cry as I talk to my daughter about that.
Absolutely. I mean, that's a great question, Dawn. I mean, what you need to do is become comfortable with yourself first about what has gone on. And if you are numb or your stomach's turning, you know, take some time before you talk to your kids about what has happened. You want to be confident
and composed
and talk in a soft voice and explain to them what occurred, but that you are here to do everything necessary to protect them. And if they need to talk to you, that you're open to listening, and then give them a big hug.
That's so helpful, because we're all struggling with this right now. Thank you, Dr. Cornbluth.
You're welcome.